So I'm just trying to figure out how the clicker works. Okay. Good afternoon, everyone. I hope you've enjoyed your lunch. This morning was really inspiring, so I'm hoping we keep up that momentum and that quality, as our convener has said. My name is Dr. Sandra Jumbe. I'm a health psychologist professionally, but I'm also a senior global mental health researcher based at Queen Mary University of London and Millennium University in Malawi. So today I'm going to be talking to you about the Mental Health Literacy E-Curriculum Project, MLEC in short, and particularly reflecting about the unintended benefits of this project in addressing intergenerational trauma. But before I go into that, I wanted to give some context into why we're focusing on mental health literacy. And I feel like I'm sitting in a room of people who are probably very well versed in this, but just for those perhaps who are not so familiar. When we're thinking about mental health literacy, we are thinking about people's knowledge, beliefs about what mental health disorders are, to help them to better recognize, manage, or prevent them. And it's grounded really in the broader concept of health literacy. And an example I always give to people in a space is thinking about, think about a very young girl who's about to give birth and become a mother. And it's really important for her to be well versed on how to best manage her child's healthcare so that they're able to grow up into another, like an older adult functioning citizen. And a core base of that is things like knowing the importance of vaccinations and also programs and adherence and what that means for the outcomes of their child. So similarly, when we're talking about mental health literacy, we are focusing really around these four components. So the knowledge about specific conditions, where to get help, and also supporting others, how to build and maintain your own mental health, and also tackling really issues around stigma. So when we think about mental health in Malawi specifically, we know that conditions like depression and anxiety are very common across the globe, and they're affecting young people. And I think we're hearing more and more about that in the media and across the world. But when you think of Malawi, it's a similar story, really. Depression is prevalent. If we have the look at the limited data we've got, it's around 20 to 30% of adolescents and young people in Malawi who are screened as depressed clinically. But then countering to that, on top of that, mental health literacy is low, stigma towards those with mental health disorders is quite high, and then the resources to actually address those issues are quite limited. And I think it's quite a common theme that I'm hearing from previous speakers. This work's really founded by some qualitative work that I started doing before, just around COVID times. And I did a lot of community engagement work with youth-led organizations, with young people themselves. And these three key points were really, really strong. The lack of words for themselves to really properly express mental health conditions in their local languages, limited spaces for them to really talk about, to really seek help, but also talk about mental health. So this is really what MLEX is founded on. But thinking about the resources available in Malawi, it's a country of 21 million people. We have 2 mental hospitals only in the whole country, Zomba, and then there's a new one called St. John, which is run by the Catholic Church. And there used to be a psychiatric unit in one of the central hospitals. It's been closed, but there's another one in the south. So really very limited for a whole country. It's just those places. And then in terms of outpatient facilities, there's really not much data. We know there's been movements to do more community surveillance, et cetera, in rural areas, but we don't really know what's going on in that sense. There are no treatment programs for children and adolescents, no specialist treatment programs. We don't really collect epidemiology data around substance use, but this is another thing that's boiling up that young people are really talking about, substance use problems amongst their parents, amongst themselves. It's quite a dire situation sometimes when you think about it. When you look at the mental health workforce, the most common mental health practitioner you'll come across in Malawi is a mental health nurse, and even for that, there's about 1 to 2 nurses for every 100,000 people. So this brings us to the MLEC study. It's a long title. So we're thinking about implementing a mental health literacy short course in colleges and universities in the country as a way of not just raising awareness of what mental health is, but getting people to really understand where they can seek help locally, help from vetted psychosocial practitioners who can provide free support to young people in the country. And we do that not just through implementing, but we've got a list on our website that we continue to update. So this is the project team. This has myself, Tinsisi, who's going to be speaking tomorrow, and then there's about 10 of us, but we always struggle to find time to get a proper group photo of everyone, but that's one of them. So this work is, again, based on top of the qualitative work we also did a needs assessment where we conducted a mental health literacy survey across the country amongst young adults, so typically between 16 to ages 30, in both rural and urban settings. And one of the questions in that survey was, do you know anyone with a mental health problem? And about 50% of the respondents, we had about 600 people respond to that, and about 50% of them said yes. But when we asked them, what is that problem? I would say 40% of the respondents completed the survey in English. So they were the ones who were able to, that word cloud at the top, the common thing was depression. And then but really, the other thing was people just said madness. There were other things that they identified, but really that was the most prevalent. And then for the rest who completed it in the local language, Chichewa, they again used this word misala, which translated is literally madness. So we are seeing here a lack of understanding of the fact that mental health can be diagnosed as different types of mental health conditions. And then the more interesting bit I wanted to share with you was that bit with the typical answer. Sorry, I put it in Chichewa because it helps me to remember what people were saying. But I'll just translate some of them. The first, that long way, is they just wander around. They just walk around aimlessly. The big one, the minogumenya, is they fight with people. They just talk senselessly. They steal. They're angry. So really, these aren't really mental health disorders in a sense. They're more antisocial behaviors, and we think this is probably what fuels a lot of stigma towards people with mental health. It's a lot of negativity around what mental health problems are. So the MLEC is a feasibility trial, and what it's looking to do is to answer the question, is large-scale implementation of a mental health literacy program for young people in Malawi university settings feasible? So we've spent the first year working with young people themselves to actually design the mental health literacy course. It's a 6-week course that can be delivered in classroom, but also we've got the same blended on an online platform. So it's a blended approach. But today I'm just going to focus on sharing the phase 2, the implementation bit, and the community engagement aspect of the program. So this is a team in action in one of the colleges. It's very interactive, a lot of discussion, a lot of role play, a lot of video lectures, just to make it really engaging for young people. But also I feel like to make it very accessible for people who are not particularly learning about what mental health is or learning about health-related programs in their universities or colleges. So we've been able to implement the first wave successfully. We've been in 4 colleges, and we've very actively recruited students who are not going to learn about mental health. So we have a cohort of teachers, people who are trained to be teachers, computer or electrical engineers, technical skills, and law students. So quite a big mix. And this is just a graph to show you the attendance rates. And really, what we've been finding is that as soon as we consent people, there tends to be just a slight dip, but really after that, the consistency in attendance is really good. It's quite stable, and people are really engaged. They really enjoy asking a lot of questions about what mental health is and how it impacts people and what stigma is, etc. So we're still in the course of implementing the trial. So I can't really share a lot of substantive findings because we're still in the process of recruiting, etc. We started the second wave. But what I thought I'd share is just a snapshot of what we found so far. So if you look on the left, BTTC is a teacher training college cohort. And at the beginning of their, before they do MLEC, they do a set of questionnaires. One of them is mental health literacy scores. So they do it before they do their, they start the program, and then 8 weeks soon after they finish, and then 3 months later. So I've got here average scores before and then after MLEC. And you can see that before, for instance, the average mental health score was at 91, which is, compared to that community survey we did, was much lower in terms of an average for both the English and Chichewa cohort. But after they finished MLEC, the score really increased quite substantially, and specifically around that issue of knowledge of mental health problems, specifically, like what are the different types, etc. That almost doubles from 28 to 41. So very promising, and in summary, just wanted to give some initial findings. What we're finding is that MLEC really is increasing mental health literacy amongst our student participants, which really can help them to self-identify, improve help seeking, etc. And we're getting really positive feedback from both our participants and also their teachers, the staff in the participating colleges. And then overall, we're finding that we're hoping we can scale it up into something that's taken up in the national educational curriculum. And just some quotes, really, I thought I should share from our student participants. So, and this is where I was reflecting and thinking about how we're actually addressing intergenerational trauma in a very unintended way. We just went and think about the participants themselves, etc. But what we're finding is, because we're engaging at the tertiary education level, what we're finding is some of the people in the room, yes, they're students, but they're also very young parents. So it's really making them think about, okay, this is what I used to not really like about the approach of my parenting and being beaten, etc., and always your parents being angry at things you do wrong, instead of explaining things to you. So when I'm a parent or with my children, I will do things this way. And the importance of communicating, etc. But also, it's making people really think about social issues that are happening in Malawi right now that are impacting on the country's mental health outcomes. So a lot of people really talk about problems around drug use, particularly young men, as a result of coping with issues around unemployment, energy poverty, worrying about your parents not being able to afford your school fees and whether you ever finish your education, even though you have the competence. And it's created a space for people to really address those things that probably they keep inside quite a lot, but within the space of the MLEC sessions, they're able to really address those issues, share from each other's experiences, and hopefully think about how they will practice in future and how they'll be around their peers, but also younger generations, and also understanding the traumas that their parents have gone through and maybe why they behave the way they do towards them. Another thing I wanted to highlight was that box in the yellow. So that's a comment from what we're getting from academic staff themselves. And the big thing that they're saying is, why are you just targeting our students? Because we are here to support the students. So it would be really good if you upskilled us so that we know how to best support our students as they come through in terms of their mental health and support. So that's something we're thinking of doing as well. So just to finish off, I'm going to also share about another big part of the project, which is community engagement. This came about from feedback from our young people who advise on the trial to say, not many young people are privileged in Malawi to go to tertiary education, to actually go to university, to actually go into college and study further, not because of competence again, but financially really most of the time, or there are not enough spaces to take them. So we thought about how do we engage people in MLEC outside of that university and college setting. So as I mentioned a lot, we do a lot of stakeholder engagement with young people. And one of the things that we decided to do is to start a youth mental health festival. And that's just an opportunity for people to come together. So people who are practitioners, people who are leading advocacy groups in mental health, and young people themselves to converge over a weekend and to, through sports and dance and music and play, talk about mental health and what it is and how it impacts on their communities on a day-to-day. So I'm just going to share about our festival. This is the first one we founded in 2022, and so we had a lot of expert talks in the hall, and some of our young volunteers did a presentation on healthy mind, healthy body. We have a lot of our stakeholders, NGOs coming with their banners and talking about what they do as organizations. And yeah, this is during the talent show, we have a lot of young youth groups that come from orphanages, from churches, etc., and they just really celebrate life. And with the sports competitions, we've got football and a netball competition. Yeah, so it's a really good way of just celebrating life, but also talking about really deep things that happen in society, then also how we can pull together as a community to think about how we can support our mental health in a place where we have low resource. So I'm going to stop there. Thank you for listening. And yeah, I'm open to questions.
Okay, thank you very much for your presentation. I just had a question about the mental health literacy program and where the role of people with lived experience is in developing and deploying that intervention, especially because we know social contact, which is contact between people with lived experience and your target audience, has been shown to be one of the most effective components of mental health literacy programs. So how are you embedding that?
Yes, so that was phase one I showed that I didn't really go into. So like I said, the MLEC is very much, has been very much developed, designed, and even with implementation, we constantly go back to our stakeholder groups. Our stakeholder group is made up of young people with lived experience of mental health conditions, carers as well, and then also youth-led advocacy groups that work around youth development or specifically mental health. So we meet every 3 months, but in the first year we basically had about 6 workshops where we looked at the content. The actual structure of the program is based on a course that was developed in Canada, but we basically took it, adapted it, stripped it, put in a lot of lived experience videos, for instance, that have been co-created by the young people themselves, stories from a Malawi voice about their experience of what it is to live with depression in Malawi, what it is to be diagnosed bipolar, what it is to support a relative who has substance use disorder, having gone through trauma. So yeah, it's quite, they have a big role in how MLEC was developed.
Thank you. That was a very interesting talk. I had a question on the terms like misala and so on, which are quite stigmatized in our context, and just reflecting on things like the Mad Pride movement and how people have reclaimed terms like madness within the people with lived experience community. Do you think that's something that would be possible in the Malawian context, where terms like misala or so on are not stigmatizing and can be reclaimed by people with lived experience, and they retake ownership of things such as that?
I feel I'm not the best person to answer because I'm not the, I guess it would be a better question to be posed to, I guess, our lived experience group. But from what they've said, they were very much anti that word because they were saying sometimes, so for instance, there's a diversity in terms of mental health conditions in themselves, right? It's not necessarily that if you have anxiety, for instance, or depression, you need to perhaps have the same level of treatment as opposed to if you're suffering from schizophrenia or psychosis-induced conditions that tend to then lead to you getting institutionalized. And we know in Malawi that's another challenge, right? I think a lot of people are scared to go. There's a place, so the longest serving mental hospice is called Zomba. And so there's this thing really deep, it's almost, it's like people are going, I'm not mad, I don't want to go to Zomba, because it's very institutionalized, it's not a nice place. And that word misala is very much linked to that place. So I think people are very anti that, and I'm not sure that movement would resonate well with people in Malawi, because I think just that word is quite traumatizing and actually impacts on a lot of people help seeking and stops a lot of people. Even families, they don't want their loved one associated with that place. So a lot of people will try and self-manage at home until it's really, really bad and they can't. So I'm not sure. That's an interesting question, but I'd like to say from what I know and what people have told me, I doubt that movement would take form in Malawi, but who knows, maybe.
Thank you. Thank you very much, Dr. Sandra.